Hello, welcome to my channel. My name is Nurse Pauline RN. I will be uploading my videos on Tuesdays and Thursdays, Eastern Standard Time. Thanks for all the people who have subscribed to my channel. Thanks for all the comments. The goal of my channel is to assist students to be successful in their fundamentals of nursing exam. Today, I'd like to talk to you about documentation. Document care, medications, treatments, procedures, health and physical examination soon as completed. Document client's responses to interventions. Document consents or refusal. Document calls made to primary physicians. Use codes as appropriate for subjective data. Open and close quotations. Documentation may either be written or recorded in the computer. Whether written or electronic, documentation is a legal document and a permanent record of the client's health status. Documentation must be recorded accurately, concisely, completely legible, and objectively, without bias or opinions. Maintain confidentiality at all times. Use correct spelling, grammar, and punctuations. Sign and your name at each entry with the date. Follow agency's guideline. Sign and use titles on each entry. Follow agency guidelines regarding late entries. Use only the user's ID code, name or password for computerized documentation. Maintain privacy and confidentiality of documentation of printed information from the computer. Do not document for others or change documentations for other individuals. Do not use unacceptable abbreviations. Do not be judgmental. For example, she looks angry. Maybe the patient is not angry. Maybe somebody at home may be in an accident, or we can't assume. So do not be judgmental. Do not leave blank spaces in documentation. Do not lend anyone your ID number to access the computers. Document correct information by drawing a line. Use a black ink pen. Insert your signature with RN. Do not use any whiteouts for erasing. When wasting medications, have a second nurse as a co-signer to your waste. Both RNs sign. Documentation for safety device, for example, your restraint. Document the reason for the restraint, the kind of restraint, the date and time of application, duration of restraint, client's response. Release restraint for exercises and for circulation. Assess skin and document. Assess need for safety device. Assess patient's response. If needs, place patient close to nursing station, or if needs, ask a family to come by and stay with the patient. Patient may respond to a more familiar face. Document new restraints every 24 hours. Documentation for restraints RN. Document every 2 hours. Evaluate response. Document offer of fluids. Taking patients to the bathroom. We may need to order a sitter for this patient. If there's a sitter ordered for this patient, please have the sitter sign that sitter book and have the patients complete a checklist. The patient will document what she or he did for the patient throughout the shift. Example, feeding, toileting, giving fluids. These should all be documented on the sitter's checklist. Adhere to confidentiality of patient's records. If family needs lab results for patient, please ask the patient's permission. Incidence report must be documented as soon as the incident has occurred. Document the witness to this incident. Document the name and time the provider was notified. Do not document incident reports in your nurse's notes. The purpose of a medical chart is used to communicate patient's care, what was done, and response to care. The medical chart is a legal record that can be used in a court of law. Flow sheets. The PCT uses the flow sheets in the hospitals, tracks assessment, treatments given, vital signs, height and weight, feeding, toileting of the patients. The techs usually document these in the flow sheets. In the section in the computer, there's a section for the flow sheets in the computer. Source-oriented charting is charting normal findings and abnormal findings. PI, an acronym for PIE, Population Intervention Evaluation of Nursing Care, addresses only nursing care based specifically on the process. Charting by exemption, CBE, charting by exemption. This charting is done like a flow sheet by the registered nurse. It's a flow sheet rather than written out. Charting by exemption charts treatment and changes in patient's condition. The Cardex is a type of paper charting. It's a flip charting like on a clipboard with all the patients in. It tells us of their medications and all the treatments that the doctor has ordered for these patients. This is a Cardex and it's a paper charting. It's a flip charting, resembles a clipboard. Narrative charting tells the story of the patient from admission to discharge. In physician notes, the physician documents latest reports of improvement or decline of patient. Graphic charting, that's for your text. They will document temperature, pulse, respiration, blood pressure, heights, and weights. Transfer forms are in the computer. You can print them out or you can complete it directly in the computer. If the patient is being transferred from one floor to the other, we use transfer forms. If patients are transferred from the hospital to another hospital, we use transfer forms. Patient is transferred from the hospital to rehab, we use transfer forms. Documentation that may lead to malpractice are incorrectly documenting time of event, failing to record verbal orders, and incorrect date. Chart as you go along, please, especially medications. Chart your pre-administration pain level out of 10. After you go back and do your post pain assessment, IVs 15 minutes, oral medications 1 hour. NDNQI is your database of nursing quality improvement, is completed daily on the floor by all nurses. We have to check all our patients. If you have very contracted patients, have your tech assist you to turn them over. We have to get all those pressure ulcers. If a pressure ulcer occurs while they are in the hospital is financially responsible for that pressure ulcer. Medication reconciliation forms are in the computers. It's completed in the emergency room, but the nurses are supposed to communicate with the nurse while they are more awake and alert, or family members may come in and can assist us to further add additional medications to this medication reconciliation list. We do skin sheets when the patients come up from the emergency room. We have to complete a skin sheet of all the pressure ulcers the patient came to the floor with. Please make sure the tech help you or a second nurse, because the floor is going to be responsible if you miss one pressure ulcers. Sometimes one patient can come up from the emergency room contracted with 10 ulcers. But since they are downstairs in the emergency room on stretchers, they fail to recognize some of these ulcers. So make sure when they're admitted on the med-surg medical floors, they are accurately documented, signed by a second nurse. The DNR forms are supposed to be completed on admission to the floors. The advanced directive forms are supposed to be completed on admission to the floors, signed by the patient or guardian. Nurse is only a witness to the form. DNR, do not resuscitate. DNI, do not intubate. No invasive procedures. Patient goes to OR for consent. The doctor is the one, or the anesthesiologist will come up and explain the procedure to the patient. If the doctor leaves or the anesthesiologist leaves and the patient needs further information, the nurse have to call them back, but it's not the nurse's responsibility. The nurse only serves as a witness to the consent. Patient leaving AMA, they have to sign themselves out, leaving against medical advice. They will leave, you take the IV out, and the second nurse will witness the signature of the patient signing out, and will give the patient a copy of this form. All documentation must be completed, intervention, pain medicine, as soon as you give it, because God forbid there's a meds call, sometimes there's more than one on the unit, or a code blue, you will be delayed. You'll be about an hour back for one patient at least, because sometimes the patients have to be transferred off the floor. Always look at MD's orders every time you administer a medication, because the doctors are continually changing orders. You may not see them on the floor, but they may be off the floor entering orders in the computer. So as soon as you administer your meds, you check the ID bracelet, identify the patient, you have to look in the computer, because within 2 minutes, by the time you go to the Pyxis and come back to the room, that doctor could have discontinued that medication or that antibiotics. So make sure you look in the computer just before you're getting ready to administer your medications. For blood transfusion, we have blood transfusion to become documentation to be completed in the computer. Patient have to give us permission to do blood transfusion. The doctor will explain to them, and blood transfusion, if the form is not completed, do not give the blood. Always make sure the form is completed in the chart. If it's not in the chart, call the doctor to come and complete the blood transfusion form. After the form is signed, you can order the blood, because after 20 minutes, that blood cannot be used. So you always make sure you have your consent before, because it will at least make a doctor 20 minutes to come to the floor, and you order the blood, you have to return it to the blood bank. When you document your own assessment. Do not document the nurse's assessment, the outgoing nurse, the one you got report from. You do your own assessments. This is a life and death situation. We can't be playing with the patient's lives. Pay attention to your edemas and your bed sores. In the computer, you have to document bed sores in the computer, length, depth, width, all of them supposed to be documented, because the wound care nurse is looking in. We have to make sure we're listening to the long sounds. Do not document what the next person have. Check those patients' lungs, especially for wheezing, those COPD asthma patients. They are something waiting to happen. Do your own assessment, not what someone else did. Okay, thanks for your time. Hope you learned something today. Please hit the thumbs up button, hit your subscribe button, and please share my video, and I'll see you. Thank you. Have a good evening.